from a research point of view and from an implementation point of view, I think we have some data that we've been using. I am, to start, I'm Maribel Almonte. I am the implementation scientist of the Cervical Cancer Elimination Initiative of the WHO within the Department of Non-Communicable Diseases of the World Health Organization. So I've spent 10 years at IARC working on research for cervical cancer, and I've been part of the initial work for developing the strategy for the elimination. So one of the things that we definitely consider is the data that we have on cancer, of course, and we know that a lot of women die of both breast and cervical cancer, which are the main cancers that actually kill women every single minute that we are speaking now. So basically, I think we had so many ideas over the years because there are several topics that we need to cover. Innovation, I've heard about, you're thinking about models of financing, how we can actually cover different points of health. But innovation also in the source of financing, but also innovations on technology for us are super important. There are still, we do have many tools to actually prevent cancer, but there is still a lot of things that are ongoing. There are many technologies that are on the pipeline that need, some support to be completed and to be delivered, and we need to give the best options for countries to actually be able to deliver simple schemes, for instance, to prevent cervical cancer, like it's been done in Zambia, for instance, and also to start actually working on breast cancer, on the early diagnosis of breast cancer. That's what we need now. On the other hand, from the implementation point of view, we thought so many times with TED and before with WHO about how can we actually concentrate some funds that can go directly to the countries for this implementation. Now that we have, some tools that we can use and that we can actually deploy, how do we actually manage some sort of sustainable fund that can be like at least the seed fund for countries to start implementing, for instance, the strategy for cervical cancer, the strategy for breast cancer, everything that women really need. And we've heard all morning that women are a large portion of the economy of every single house and of every single country. And they are the ones that actually maintain the family. And when a woman dies, there are a lot of orphans left as well. So I guess this is the point. We wanted to actually, at some point, have a fund that can be managed by, I don't know, WHO, other institutions, whoever could manage to actually give it to countries to start.